my name is Oshi and this is a product demo for Sno-MQ B2I's semantic platform for interactive healthcare data processing. Today I was planning to do an actual live product demo, but before we get into details on how the web application works, I would just like to recap on some of the questions that we got in regards to why we chose Sno-Med City as our reference terminology. So among all the EHR related operations, so for storing and retrieving clinical information, we think that Sno-Med City is the terminology that should be used. This is because Sno-Med City can ensure the semantic richness and the level of granularity that allows capturing all kind of clinical information, even very, very detailed type of data. And as well, Sno-Med City is not a classification, but it's an ontology, and it means that it has some encapsulated semantics that we can utilize when we would like to create queries and when we would like to retrieve knowledge from our patient data. So Sno-Med City is a comprehensive set of clinical concepts. It covers everything that can be that needs to be recorded during a clinical encounter. So it contains codes and concepts for diseases, for procedures, for observables, for body sites, for administrative concepts, and as well as for pharmaceutical domain and substances. Sno-Med City is not a single axial classification. Concepts can have multiple categories that they belong to, so they can have multiple parent concepts, and as well there are semantic connections between concepts that enables retrieving concepts based on a semantic search criteria as opposed to using only lexical or hierarchical searches that we could do with a standard classification. So just for example, on the screen we're looking at a concept, acute streptococcal bronchitis. This is the clinical definition of this particular disease that we're looking at. It has two human-readable labels, so it's possible to find the components by these labels if we just want to run a very simple lexical search, but it has a lot of attributes that are both clinically validated, so clinicians do thorough review on this content before it gets published and before it gets used. So these definitions are clinically correct and validated, and these definitions are also machine processable. So we can search for this concept by querying causative agent and retrieving concepts that are caused by the same causative agent. For this example, this is the streptococcus, or similarly to that, we could query just by finding site and retrieve all the diseases that affect the bronchial structure. We will look into some concrete query examples that demonstrate the power of these semantics, the power of these semantic relationships between these concepts. Besides that, Sno-Med is mapped to a number of other terminologies, classifications, for example, the ICD-10 or ICD-9, which opens up the field for even more categorization options. So let's take a look at Sno-MQ and see how Sno-Med City is utilized for querying and searching and analyzing electronic health records. Currently, what we're looking at is a query that returns all the patient records that we have in the system, and all the patient records that we have can be displayed in a very, very simple table view. So here we have over 1 million patients imported, and in this table we can just review a list of these patients with basic demographic information, and by opening up a patient we can look at more details on the clinical history of this particular patient. So let's focus on this per patient. We can see that this is a female patient born 2003, and the observation period is quite short. It's a little more than a year, but we can see that during this time quite a lot of things happened to our patient. First of all, there were conditions recorded, and if we hover over with the cursor, we can see the type of condition that the patient suffered from. And since this is a timeline, we can see when it actually happened and when it happened in comparison to other conditions. We can zoom in to see more details for this patient. Fortunately for her, there aren't too many conditions, but sometimes this screen can get really dense if a patient have a lot of clinical encounters. So in those cases, it's very useful to be able to scroll and focus on just a certain period of time. The second swim lane is the drug exposure, which sometimes is only a single day exposure. For example, for a vaccine, which is just one single shot, and there are multi-day exposures for medications like phenylephrine that was taken for a longer period of time. The third swim lane stands for clinical procedures, and similarly to the conditions that were recorded, these procedures are as well encoded using Sno-Med City. So we know that our patients suffered from these kind of diseases. We know the name of the diseases. However, it is very important that since everything is encoded in Sno-Med City here, we know much more of this patient than what is actually on the record. So if we look up this acute bronchitis that is on the patient record, and look at this clinical concept in Sno-Med City. So this is now already the terminology browser view for Sno-Med City. On the left hand side we have a hierarchical structure that displays these parent-child relationships between diseases and their more specific, more detailed forms. And on the right hand side we display details of a selected clinical concept. So we're looking at acute bronchitis. This is the concept that was recorded on our patient page. And we can already see that there is a lot of information in relation to this concept. There are two human readable terms just for simple lexical searching and interpretation. And there is a number of properties that are already machine readable that point to other concepts within Sno-Med City, and that give us these properties give us a definition of what this actual concept means. So for this case, if we don't consider the hierarchical properties because they provide a categorization, we can see that we know that this is an acute sudden onset and or short duration disease. It is associated with morphology which is called acute inflammation, and the finding site is the bronchial structure. So if we were ever going to create a query or a categorization of concepts based on some of the definition that they have, then these are the type of properties that we could use. So for example, it is possible to create to retrieve a set of concepts from Sno-Med City where the finding site for all the concepts is bronchial structure, and they do not necessarily have to be inflammations, or they do not necessarily have to be infectious diseases or neoplasms. The only thing that we know about them is that they're all located in the bronchial structure, and this is one very important differentiation between Sno-Med City and single axial simple classifications, is that it's not only a lexical search that we can execute here, but we can look at what the actual meaning of that clinical concept, and we can create groupings of concepts based on that meaning. Let's take a look at this hierarchy again. So this is a multi-axial categorization of concepts. Right now we're looking at acute bronchitis, but it's possible that a clinician have more information of that concept. So for example, a clinician knows that it is an infective bronchitis. Moreover, it is a bacterial infection and it is caused by Streptococcus. So in this case, the clinicians should have the option to record this detailed concept on the patient record, where besides the previous information that we were looking at, we know that this has a causative agent, which is Streptococcus, and this is a bacteria. And we know that the pathological process is an infectious process. So the further down we go in the hierarchy, the more and more information we get on the clinical meanings, on the concepts, and this is because of the granularity getting higher and higher with each step as we move down in the hierarchy. This means that it is possible to record something in a very, very high detailed manner, but if there is not enough information available, we can of course pick a more high level, more abstract concept and just use that for the recording. So this is what we use for the basis of creating terminology searches or terminology queries. We have in Sno-MQ an option to build a terminology search and retrieve Sno-Med city concepts based on categorizations, parents, or meanings. For example, if I'm interested in all the infectious diseases, I can create this very simple query of infectious disease, which returns a lot of Sno-Med city concepts. Over 6,000 infectious diseases are recorded in Sno-Med city. However, they're all classified under this infectious disease node. Possibly, they're classified under other nodes too. For example, this upper respiratory infection is probably not only a subtype of infectious disease, but it is also a subtype of respiratory diseases. So it's an intersection of that too. It is possible to add more search constraints and search not only by hierarchical position, but by those properties that we were looking at that define the concept's meaning. So if I add a property constraint where I'm looking to return everything that was caused by causative agent Streptococcus, and you see that I have a lot of options here in the list to select from, but the icons help in identifying the right one. So we can see that the results are very limited. Now, instead of the 6,000, we only have 40 diseases that fulfill this search requirement. But we're not only looking for concepts that are exactly caused by the Streptococcus bacteria, but any subtype of Streptococcus, which can be a specification of that particular bacteria, and this returns us around 100 results. We can handle we can look at this query and the set of results as an intentional reference set, which is defined by a search expression, by a semantic constraint, and the actual ref set contains these 100 concepts from the ontology that really match for these constraints. It is possible to create a lot of different types of these filters, so of these intentional query reference sets. This is one of the simple examples. However, in Sno-MQ, even though we prefer using semantic searches, we understand that sometimes it is not possible because not everything in Sno-Med has this clinically validated semantic definition, and for those cases we also enable running lexical searches or even combining the two. Since those are more complicated examples, I will not cover them today. Once we created this query and we identified the set of concepts that we're looking for when searching electronic health records, the next step is to look at the patient database and select all those patients that have any of these diseases, any of these clinical findings recorded on their electronic health record. And for that, the next step to do is to build a patient cohort. On the cohorts tab, we can just create a new cohort and specify what is the search criteria that we would like to apply on our patient population. So in the final cohort, we will have a list of patients that share the same characteristics, the characteristics that we defined on this page. So let's say that I would like to find all the patients that have ever had any streptococcal infections, and I'm only interested in females. So for this, I add a demographic constraint. And I have to add an exposure for which I can select from these already authored filters that I have in my database. And I will use this streptococcal infections filter. Running this query returns 26,000 results, and we can look at some of the results to verify if they're indeed the type of patients that we're looking for. So let's look at this first one. This vertical line is for the baseline exposure, which is the disease that we were looking for at the first place. And you can see that this is streptococcal sore throat. It looks fine. It looks like we're on the right path because this is a streptococcal infection. So this patient is a good match, and we can assume that the others are as well. So there is no need to review all the 26,000 because we're using the same search method on all these patients. If we want to explore the patient data and identify what other queries we can run, what other questions we can ask from our data, then browsing these patient profiles is a very easy way to do so. For example, if we're not only interested in the number of patients that have any streptococcal infection, but we would also like to have some statistics on how they were treated, what type of medications they received, then we can get some ideas here just by browsing patient records and looking at single patient profiles to see what other events they had in relation or independently from this streptococcal infection. So once we have the cohort, there is a lot of things that we can do with this cohort. Sno-MQ implemented a functionality for statistical processing and statistical analysis of patient records, and that is our semantic notebook functionality. I have a few example notebooks here for you to show as ideas on what notebooks are capable of. But this is just a very, very low-level introduction, whereas the limit is really the sky in statistical processing. We incorporated R, so statistics can be defined using the language R, which is what most of the statisticians are familiar with. But we also included some very, very simple descriptive statistics just to demonstrate that these are the type of operations that we can do on any type of population. And by descriptive statistics, I don't only mean that we look at the demographics and create charts from that, because that is possible. For example, this one is describing our entire patient population by age and gender, age and sex. But descriptive statistics can also utilize the semantics within Sno-Med City. So, for example, if my question is, I would like to know if a female gets a streptococcus infection, which is the body site that is most vulnerable? Which is the body site that is most likely going to be infected by streptococcus? Then we can use this data to do some secondary analysis and retrieve this information by looking at our patient cohort that we've created with all the females that encountered some kind of streptococcal infection during their recorded life cycle. So this is the semantic notebook where we have cells with different language support. And I'm going to skip the technical parts that you can see at the bottom, and we will just focus on the results of the report. So you can see we had 4 steps to identify which body sites are most in risk to get streptococcal infection. And what we did already, we filtered the Sno-Med City concepts to find the right set of concepts that describe streptococcal infection. We built the cohort of the female patients that were infected by streptococcal bacteria, and the next 2 steps are the steps that are to be executed using this notebook. So from the set of patients, collect and order all the matching conditions by frequency of occurrence and take the first 10 most frequent conditions. So what we do here using this code, which I'm not going to go into details about, is that we look at our patient cohort and we see that the streptococcal infection that was recorded on their page, which disease it is exactly, and we created a chart of the most frequent. Only by eyeballing the data, as we did before, it is obvious that the streptococcal sore throat is the most likely to happen. However, pneumococcal pneumonia, streptococcal infectious disease, scarlet fever, and some other streptococcal infections are also present on the records. So this is the 10 most frequent clinical disease that we can find on these patient records. And the question that we would like to ask is the body site which is affected. So the body site that is really the infected piece during the course of this disease. So it is not very difficult to infer that the first most frequent body site will be the throat. Using a clinical language, it's the pharyngeal structure. But we can also see that the second most vulnerable body part that can get streptococcal infection is the lung structure, and it is also possible for having skin infections by the streptococcus bacteria. And we also have a few more options, but it looks like the first 3 are really covering the majority of the diseases. So our question was that for females, which are the body sites that are the most vulnerable when it comes to a streptococcal infection? And to get to this answer, we went through a series of steps when first we identified the types of infections, then we matched the patient records against that list of diseases that we identified. Then we further inspected the patient records, collected the most frequent diseases, and traversed the finding site relationship on the Sno-Med city concept that describes that disease and retrieve the body sites that were most likely present on uh, within these diseases. And that is the end of this seemingly very easy question, and this is the answer that we received. This answer is only possible to get if you have the ability to traverse these semantic relationships. So similarly to finding site, we've seen that there are a lot of other relationship types like associated morphology, clinical course, uh, pathological process. So these can all be used to ask further questions. Mm, the possibilities with Sno-Med are pretty much endless because each clinical domain, diseases, procedures, family history of diseases are all described with various semantic attributes, and each can be used to query and retrieve concepts by meanings or fragments of concept definition. So this was a demonstrative example for a very, very simple descriptive statistics, even though it requires multiple steps to be executed. These steps are easily understandable for most of the people who have a basic understanding on Sno-Med City, and the analytic part doesn't require too much statistical understanding either. However, it is possible to do more advanced analytics, for example, to compare different cohorts and check if there is a difference or if there is a correlation, and that enables doing secondary studies to reveal drug interactions or drug adverse events or drug new indications or correlations between diseases. For example, I have a notebook here which does the following. We have two patient groups here. One has diabetes and the other doesn't have diabetes. To select these patients, we created a Sno-Med City query that returns all the concepts that describe some form of diabetes, and we applied that uh, concept set on the patient records. We matched the patient records against that list of concepts, and those patients that had some type or some of those concepts on their EHR were put into the patients with the diabetes, whereas we also have a control group with the patients that didn't have any diabetes. And on these two groups, we were looking for occurrences of bone fracture. Bone fracture is also described with a Sno-Med City query, where we're returning all the diseases that are associated with a morphology called fracture and that are located in some bone structure. This gives us the entire list of bone fractures, and it doesn't matter whether they're in the extremities or in the skull or anywhere else. The only thing that we care about is it should be bone and it should be a fracture. So from all these different hierarchies of the different types of fractures, we can collect everything into this one concept set. And the two cohorts that we have, the diabetic group and the control group, were checking for the occurrence of bone fracture. And this is what we're doing using the cohort building UI and this notebook page. And what we're really looking at, after skipping some of these codes that is not relevant for now, is that in the control group, the proportion of bone fracture is 5%, whereas in the diabetic group, our bone fracture is 6%. So we can see that in the diabetic group, it is more likely that the patient have a bone fracture than it is in the control group. this is something that we can see just by looking at these charts. However, it is also possible to verify these using statistical analysis and chi-square test, which tells us whether this is just a difference that we observe based on the charts, or if this is a difference that is actually significant for this particular patient population that we're examining. This example was a bit more advanced from the statistical perspective, but the bottom line is still that with very simply built Sno-Med CT queries, when we are looking to traverse the semantic relationships to identify a group of concepts, it is possible to ask complex questions from the system and get answers real time using the semantic notebook functionality. Thank you for your attention. Have a nice day. Bye bye.